Welcome, everybody. We're down to just the last two shows of the year. And in one sense, the news has been kind of slow the last few days. But in another sense, we have entered what is maybe the craziest time since the start of the pandemic in terms of the coming together of, number one, extreme pandemic fatigue, number two, an outrageously contagious variant with record number of cases, which officially are not even close to what the real number of infections is. And we will talk to that. And it is abundantly clear that the next, I would say, 6 to 8 weeks are going to be extremely unstable in terms of the range of the sorts of reports that we're going to get. So, I mean, let's just go through it. As predicted, the extremely contagious Omicron variant is rip-roaring its way through the United States. Record numbers of cases over the last couple of days as the data from the holiday weekend has been processed. We had on yesterday 313,000 cases officially reported. Now, it's a crucial detail to understand. This is nowhere close to the real number. If you do an at-home test and are positive, and then you don't go and get a PCR at some location that officially reports these numbers, that positive home case doesn't show up in these numbers. In addition, because somewhere between 40 and 60% of Omicron infections are completely asymptomatic or almost completely asymptomatic, you might have a slight headache, little scratchy throat, not even something that would say to you, I've got to go get tested. A ton of people aren't even getting tested, never mind only getting a home test. So, Dr. Fauci talked about we might see 1 million cases a day in the United States. We may be there already. When you have 312,000 officially reported cases, you can conservatively assume that between home positive tests and people who don't even get tested, you've got at least 2 times that number, which would put us at about 650, maybe even 3 times that number. So these are completely incredible numbers. Other signs that this is absolutely everywhere include positivity rates in some places. New York City now has a positivity rate of almost 20%, meaning if you go and just look at the percentage of tests that are coming back positive, it's about 1 out of 5. Almost 1 in 5 New Yorkers who took COVID tests received positive results in the latest batch of data. The latest case count is a drop, but overall testing surged ahead of the holidays, skewing the figures. In England, there's a report that if you have cold symptoms, right? If you look at this is now not a subset of people getting tested. This is a subset of just people with cold symptoms. Half of them are believed to have COVID, the Omicron variant, which is now dominant in the UK. Now, on that note, Omicron being dominant, this is the next level of chaos. If you've been following the question, what percentage of American cases are Omicron versus Delta? There was a report from about, I want to say 10 days ago, which said something like 75% of US cases were then Omicron, suggesting that by now it's got to be close to 100%. Not so fast. That data was mistaken. There is now a new report from the CDC which cuts the estimate of the prevalence of Omicron in the United States. Omicron is growing dramatically in the US, but the numbers we got were wrong. The CDC revised downward the estimate of the percentage of COVID that is now Omicron. According to agency data, Omicron accounted for 59% of all infections as of December 25th. Now remember, the week of the 18th, they said Omicron is already 73%. Turns out that was only 22%, and the number is now 59%. So is Omicron more contagious than Delta? Yes. Is it increasingly a larger share of all US cases? Yes. But the numbers were wrong. The numbers that we originally got were wrong. And the new estimates, as The Hill writes, mean that while a majority of new infections are Omicron, Delta has not been sidelined and is still about 41% of infections. So that is, again, another change, which is we thought that by now it would be all Omicron. It turns out that it is not As of a few days ago, it was about 60%, meaning 40% of cases are still Delta and Omicron presenting with different severity, different symptoms, different level of vaccine evasion. Another element of chaos is the CDC deciding to change the quarantine and the isolation guidelines. And what I initially suspected was a change mostly motivated by economics and finance and meaning industry wants people working, seems to be exactly that. And so much confusion over these new guidelines. The CDC has shortened recommended isolation and quarantine periods for the general population. The CDC is sort of saying it's medically oriented, although many doctors are saying it's not really clear that there's a medical justification here. There's a debate about that right now. The new rules are CDC is shortening the recommended time for isolation from 10 days to 5 days if you have COVID, if you are asymptomatic, followed by 5 days of wearing a mask around others. The change is motivated by science demonstrating that the majority of transmission is happening early in the 1 to 2 days prior to symptoms and 2 to 3 days after. Of course, if you don't have symptoms, it's hard to say which are the 1 to 2 days before and 2 to 3 days after. So this is the confusion. The guideline now is if you test positive, isolate 5 days. If you're still asymptomatic, leave isolation, keep masking for 5 days. Additionally, the CDC has updated the quarantine period for those exposed, not infected. If you're unvaccinated or more than 6 months out from your second dose and not boosted, quarantine 5 days and then wear a mask for 5 days. If it's not feasible to quarantine, wear a mask for 10 days. If you've had your booster, you don't need to quarantine after the exposure, but still wear a mask for 10 days. And for all exposed, get a test at day 5. If symptoms start, quarantine immediately until you get a negative test or can confirm that your symptoms are not due to COVID. The immediate question is this just a business thing? And Dr. Rochelle Walensky appeared yesterday on CNN. First of all, was asked, why are we not demanding a negative test? Listen to what she had to say.
The UK has also shortened its period of isolation to 7 days, but with a negative test on day 6 and day 7, a negative rapid test. Why didn't the CDC recommend taking a rapid test after those 5 days?
Yeah, really important question. So we do, just to be clear, recommend having a rapid test during your period of quarantine after you've been exposed. But we opted not to have that rapid test. For isolation, exactly. We opted not to have the rapid test for isolation because we actually don't know how our rapid tests perform and how well they predict whether you're transmissible during the end of disease. The FDA has not authorized them for that use. We don't know how they perform.
So this is a really important point. These rapid tests that many of us have relied on, they really are more accurate when one is symptomatic. And I'm going to talk today about I faced off against Omicron, and I'm going to tell you about it. And rapid tests are a big part of what I'm going to talk about. So Dr. Rochelle Walensky saying, if you're asymptomatic in these cases, it's not really clear how much the rapid tests actually tell us. And then the question comes about, are these new recommendations medically oriented or business oriented?
So from what you're saying, it sounds like this decision had just as much to do with business as it did with the science.
Well, so it really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to. And so we really want to make sure that we had guidance in this moment where we were going to have a lot of disease that could be adhered to, that people were willing to adhere to, and that spoke specifically to when people were maximally infectious.
Yeah. So there is no doubt that a big piece of this is just what are people willing to tolerate, quite frankly. And so I am not blaming anyone for any particular wrongdoing. I'm pointing out that the case numbers are so out of control. It is not clear we can vaccinate our way out of infection. We can hopefully vaccinate our way out of serious illness and death, although when I tell you my story later, you might change your mind about that as well. We'll get to that. Let's next talk about the domestic travel vaccine requirement. One of our sponsors is called Privacy. Privacy is a totally free service that I've been using for years. Privacy lets me create virtual payment cards with one click, and when I use the virtual card, the money is taken out of my bank account. You can create multiple cards, delete them, freeze them, set a spending limit on them. Let's say I'm signing up for a free trial and it requires a credit card. Privacy will autofill a virtual card number, and then after signing up, I can delete that virtual card. So I know I'm not going to be charged again. Something really useful and very practical. Or let's say I'm ordering food over the phone, but I left my wallet somewhere. I don't have my real credit card on me. I can use a virtual card on my Privacy mobile app. But really the best part is you're not out there exposing your real credit card number, so you're not as susceptible to data breaches and identity theft. Privacy is a totally free service, and you'll get $5 to spend when you go to privacy.com/Pacman. The link is right underneath this video.